Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hello, everyone, and welcome back to the Gastro Girl podcast, your trusted resource for evidence-based digestive health information, expert insights, and real patient stories. I'm your host, Jacqueline Gaulin. Today's episode is brought to you by Ardelyx. Today, we're exploring an important part of the IBS-C journey that often doesn't get enough attention. What happens after you get a prescription? To help walk us through this step-by-step journey, I'm thrilled to welcome back one of my favorite guests, Dr. Brian Lacy, a leading gastroenterologist at the Mayo Clinic in Jacksonville, Florida. He is also a professor of medicine in the Division of Gastroenterology and Hepatology. Dr. Lacy, thank you for joining us today. It's so great to see you again. I love having you on the podcast. You're definitely a fan favorite and you're beloved on all of the episodes that you've done with us, and we're always happy to have you back.
You are making me blush.
Just so we can kind of set the stage, a lot of folks jump in at our episodes and maybe they don't know they have IBS-C. What is IBS-C? Just the short and sweet version.
Sure. I think the first teaching point might be you don't need to overthink this. Let's really simplify. And when we think about IBS, irritable bowel syndrome with constipation, it's really two key parts of the definition. One, the presence of abdominal pain or discomfort. It's typically lower, it can be mid-abdomen, even upper abdomen. And the presence of that abdominal pain or discomfort along with altered bowel habits. And obviously for our patients with constipation, that may mean infrequent bowel movements or hard bowel movements or struggling to evacuate stool. Beyond that, that's the definition right there. We don't need to overthink it. And it's very common, affecting about 10% of the U.S. population.
Now, you've been on episodes before where we've talked about treatment options, and treatment has evolved over the years. There's lots of different, not only pharmacological treatments, but there's also gut-brain interaction therapies, as well as dietary interventions. But for this, we're mostly talking about some of the treatment options that are newer or the standard. Like when you have IBS-C and you're diagnosed, what are some of the options that patients have in terms of treatment?
For the patients I see, they likely have already tried over-the-counter remedies, but it's worth at least mentioning that some patients with very mild symptoms may get better with over-the-counter remedies, such as polyethylene glycol sold as Miralax as an example. But remember that medication may help constipation, but doesn't help the abdominal pain component. And that really is the critical part of the IBS definition. So typically the patients I see in my practice are those who may have tried over-the-counter agents but have persistent symptoms, or tried dietary agents and dietary interventions but have persistent symptoms. And so then we have the discussion about what therapeutic options, what prescription medications are out there. And I might just add the caveat that similar to other common disorders like high blood pressure or thyroid disease or elevated cholesterol, we're not curing that disease state. We're not curing hypertension or elevated cholesterol or IBS. We are taking care of symptoms to the best of our ability. We're kind of caring for these symptoms, trying to improve quality of life, but we're not curing it. And that's really important for patients and providers to remember.
Great. So when somebody comes to you and you prescribe them a medication, how do you coach them on what to expect? Like the initial days, like, are they going to feel relief right away? Does it depend on the patient? Does it depend on the treatment? Help us understand what to expect when we are prescribed something.
Yeah, and so what's nice is we have a couple of different options, so we can go through those later. But a typical discussion might be to focus on symptom severity, as you mentioned, and you might imagine that somebody with more mild symptoms might respond a little bit faster and maybe a little bit better than somebody with more severe symptoms. So we talk about that a little bit. And part of this is setting the stage about expectations. What do we expect from medications? And so I'd like to discuss expectations in terms of how do you respond in terms of constipation symptoms, and how do you respond to your abdominal pain. And what we've learned from most of the studies from the FDA approved medications is that typically constipation symptoms improve first. And so, for many of our patients who get a prescription medication for their IBS constipation symptoms, they'll notice a benefit in terms of constipation symptoms, certainly within the first week or two, sometimes within a few days, rarely at 10 to 14 days. But most patients say, boy, after a few days or after a week or 10 days, constipation symptoms are much better. But what may lag behind is the abdominal pain. And we have now very good data from large studies showing that continuing the medication, and that's important, continuing the medication,
Yeah.
don't giving up too early, will lead to a higher chance of improvement for your abdominal pain symptoms.
So when when patients, a lot of times we take a medication and we feel better and we stop taking it. Is there like a window of when a patient can expect to have the full benefit of it, and why it's important to keep staying on that treatment that the doctor recommends?
You're absolutely right. And we know that, taking a medicine every day can be bothersome for a lot of people. It's a nuisance, it's an annoyance, it's a hassle. And how do you figure that into your daily, very busy schedule? But we do know that for many patients with more persistent symptoms of IBS with constipation, that daily dosing has been shown to be most effective. By the way, there may be the occasional patient who just needs it every other day, or even 3 times a week. And that's a discussion with your healthcare provider. But we know that your constipation symptoms on daily dosing, whether it's linaclotide or plecanatide or tenapanor as examples, should improve within 7 to 10 days. And that's been well documented. But the abdominal pain may not improve for 4 to 6 to 8 weeks. And so the teaching point is we know from very large studies with tenapanor and linaclotide as example, and plecanatide, if you give up too early, you may have realized the benefits of the constipation symptoms, but not the benefits of the abdominal pain or even the bloating. So a full 8-week trial at minimum, and for some patients, even 12 weeks is the way to go.
Now, I know we've talked about this in the past. It's that expectations. And what does better mean? What is feeling better? What are you looking for when you ask that question? And what do patients expect? So when when you talk with your patients, we all are human. We want quick relief. We want instantaneous results. So how do you help them balance, the hope with realistic expectations?
Yeah, such a complicated question, right? Because you can imagine that as a patient, if you've been struggling with your symptoms, and the average IBS patient, by the time they see a provider for a second or third opinion, they've had 5 years of symptoms. That's kind of the average patient. And so we know that this is a chronic disorder, unfortunately, for many patients, no different than chronic back pain. And even though you've had symptoms for several years, you want to get better today, right? Because we all want you to get better today.
Yeah.
And so sometimes that discussion about what is a realistic response is really important so that people don't become too frustrated. And so what I would tell patients in my clinic is that, gosh, Mrs. Jones, it's taken you several years to literally get here in terms of your symptoms. You've tried medication A, B, C, you've tried diet E and F. We need to give this some fair time. What I expect is that if we start this medication, again, we can fill in the blank, whether it's linaclotide or plecanatide or tenapanor, because we have good data for all of those as examples. I expect that probably in the next 7 to 10 days, you're going to find your constipation symptoms are better. I suspect that over the next few weeks, you may notice an improvement in bloating, a common symptom that accompanies IBS with constipation, a sense of gassiness and bloating and being distended. And we have very good data that all these agents are much better than placebo or polyethylene glycol for bloating. And don't be surprised that as we continue this medication at 6 weeks, 8 weeks, 12 weeks, you notice a significant improvement in your abdominal pain. And we have good data to support that as well. But you can notice how it's kind of a time series that you're going to notice some benefits early on, some a little bit later, and some with more persistent therapy. And so, again, the teaching point there is don't give up too early, right?
Yeah. And also, we're all different. IBS-C looks different in different patients, and some may have more days without a bowel movement than others. They may have more bloating and pain than others. So that better might look a little different for each patient. So it's important for patients to know that, correct?
Oh, absolutely. And so, when we think about IBS, irritable bowel syndrome, it's a syndrome. It's a collection of different symptoms. And even with IBS and constipation, individual patients have individual symptoms. Everybody's unique, and some may be more pain predominant, some may be more constipation predominant, some may be more bloating predominant, although we put them under this bigger umbrella term of IBS with constipation. And so, yeah, it wouldn't surprise you that some people respond earlier, some people respond differently. And as a corollary to that, too, we also recognize, as you've mentioned on some of your other wonderful podcasts, these other disorders of gut brain interaction. And so, if you have IBS with constipation and overlapping functional dyspepsia, as an example, and they frequently overlap, it may take you a little bit longer to respond than if you just have IBS with constipation, right? Because the more of these other diagnoses of disorders of gut brain interaction, it may take you a little bit longer to respond.
I love this insight because I think as patients, we get so stressed and anxious and we're so hard on ourselves and we start blaming the medication that's not working and then get frustrated. And then, because these are disorders of gut brain interaction, it starts the cycle of anxiety and what that does too. And it's like almost like a vicious cycle. So I'm glad that we can have this candid discussion, and hopefully our listeners out there feel some sense of relief in knowing that this is a process, it's a journey. And the way that you've explained this, I hope that our patients listening really understand that there are providers that can, like yourself, who really understand how to speak to patients so that they're not unrealistic in expectations. Because sometimes when we have unrealistic expectations, we set ourselves up for failure. And then we start the whole cycle of, this is terrible, I'm never going to get better. And we don't want that for patients.
Absolutely. I like that. And although we've barely tackled your first question, if I just take, no, this is wonderful. This is what it's all about, right? But
Yeah,
if I
yes,
take a brief segue, and so at least when I explain to my patients, we talk about this brain gut connection,
yes.
but also the point that if we focus, and many of these medicines really focus more on the gut, that if we don't also address other issues, and you can imagine people get frustrated and they get discouraged and they may have sleep issues and maybe there's some anxiety. But if we also don't think about those other things, simply giving somebody one pill a day probably won't magically cure all of those symptoms. And so we really have to really look for this holistic approach and think about, let's talk about your diet and let's talk about your sleep patterns and let's talk about how you deal with stress, and to really maximize a chance of success for any treatment.
We just did an episode, kind of, it goes together with these on IBS-C, about complementary therapies. And it's really important that you brought this up. So how, in your eyes, how do these complementary therapies fit in this journey of managing IBS-C and also expectations for patients?
Yeah, I think it's a really good question. So the way I like to think about it is we shouldn't keep our blinders on. I think we need to be open to new ideas and new theories, and we need to be receptive to that we can't say, gosh, this is the only medicine for your IBS and that's it, because that shuts the doors on possible treatments that may help patients improve their symptoms. And so as a corollary to that, we should think about, could you use medication A for your IBS-C symptoms, but also maybe is there some alternative approach? And the definition of alternative keeps changing.
Yeah.
What used to be alternative 30 years ago is now standard of care. And so maybe somebody will have some benefits with probiotics or with the addition of a diet or with the addition of hypnotherapy or behavioral therapy. So I think we should keep our blinders off. We should think oftentimes about what we call augmentation therapy. You don't need just one thing. Maybe you need to layer on a little bit of this medication B, a little bit of hypnotherapy, alternative therapy C as an example, and layer it on because, as you mentioned, everybody has their own individual sets of symptoms. And so we really need to personalize therapy. One size does not fit all, right?
Yeah, and we're so fortunate as patients and as providers. I'm sure you feel the same way that there's been such an evolution of the science. There's been such a growing body of evidence that show multiple ways, multiple faceted ways to treat these disorders and syndromes like IBS with constipation. Also that because we're looking at it multifactorial, there's also multi faceted ways to treat this as well, which I think it's just in the time that I've been involved with digestive health, it's evolved so much. And it's not that it's a great time to be a patient. You don't want to be a patient, but it's a great time to be a patient when you have these wonderful options and providers that really understand this approach to offer you the best treatment plan.
Agreed. Couldn't have said it better. And so you're right. I don't want any of my patients to have symptoms, right? That said, this is an exciting time. And this is what makes this field so interesting that compared to 20 years ago, even 10 years ago, there have been significant changes in the field, which has led to significant improvement in patient symptoms. So that's exciting to me. And we're only going to see more in the next decade.
Yeah, and you've been one of the ones leading the charge with your great research. I can't wait to see what's coming for ACG this year. I look forward to some of the papers.
Well, we can't let all the cats out of the bag
I
too early.
know. I know. But going back to the patients, what are some of the common challenges that patients faced after starting treatment? I think this is a good question because, we all like to feel like that we're not the only one. Even though we don't like to hear you're not the only one, we like to feel that we're not the only one
Right.
in our journeys.
Okay. So let's think about let's assume we're not fighting with the insurance company.
Yes.
There aren't approval issues, that you've got the medicine and we think it's the right medicine for you. What are some common things that might come up? I think the first thing is some people with IBS and constipation all of a sudden start having some loose bowel movements or a little bit more urgent. And that's a little bit of a weird sensation for people like, oh my goodness, what's happening? But to me, that usually means that the medicine is just working very effectively. It may means we may need to reconsider the dose. That, fortunately, for some of the agents, such as linaclotide, we have several doses available. Or maybe we need to consider less frequent dosing. So maybe that patient does require every other day dosing. That said, for the vast majority of patients with IBS and constipation, when started on a prescription medication, if they are in the small group of people where they have more loose bowel movements or urgent or diarrhea, that typically resolves on its own after a few days. And oftentimes, no changes are necessary. So I just let people know in advance, hey, first day or two, don't get on a bus and go for a long bus trip without a bathroom. It may give you a little bit of urgent diarrhea. Take it at home, not at work. But if it occurs, usually that just goes away on its own, and that's all we need to do. I think the second set of expectations might be, when will all those other symptoms get better? And so we talk about bloating. Bloating's not part of the IBS definition, but it is present in 60 to 70% of patients with IBS. And they want that gas and bloating and distension, that physical manifestation, to get better. That usually follows after the improvement in bowel habits. And then, as we've already mentioned, the improvement in abdominal pain. But typically, it's kind of dealing with the looser stools or more urgent bowel movements at the start. But again, that generally just goes away on its own.
So it's something that to be expected. And if it's a good point to bring up to your provider to make sure that you're on the right dose after a day or two.
Absolutely, because you could imagine if I was a patient and I wasn't told that, now I'm at home over the weekend, I'm having urgent diarrhea, I'm thinking, what is going wrong here? You'll likely stop the medication and you may never go back. And we've lost that window of opportunity where we can really help somebody.
One of the other challenges, and you've probably seen this, is adherence, right? And how this impacts the journey and expectations and all of that. Can you address this? Why this is such a critical point.
Yeah, medication adherence is really hard for most adult Americans, and not just Americans. As in a good example, patients with significant heartburn, daily heartburn, when given a medicine to treat their heartburn at the end of the month, only 50% are taking it as suggested on a daily basis. And we see similar results for patients with IBS. And so, it's hard to take a medicine every day. It's a nuisance, it's an annoyance. That said, what I try to tell our patients here is the GI tract loves routines, especially for constipation. So we try to get people into a routine. We teach that the GI tract kind of goes to sleep at night. It kind of quiets down. It tends to awaken in the morning. And so we incorporate that into taking the medicine daily. So kind of get up at the same time, take your medicine, have that big mug of coffee or tea, which stimulates that stomach colon reflex. Have a little bit of a breakfast. Putting food in your stomach sends a signal to colon. It's time to go to the bathroom. And by the time you've done all that, it's probably you're getting that urge to go to the bathroom because the medication has kind of kicked in, and that morning routine really works well. But that emphasizes the point of taking that morning medicine for your IBS symptoms.
Oh, thank you. Are there any other challenges that you see in your practice from patients?
Generally, most of these medications are really pretty well tolerated. Lubiprostone, also sold as Amitiza, as most of your listeners will know, is very helpful for IBS with constipation symptoms. Some people have some symptoms of nausea, but we've learned that if you take it with food, that nausea usually just resolves, and it's not a dangerous side effect, and it doesn't mean anything bad.
So just to recap for this section, what are some solutions that you recommend patients to keep on top of their adherence? Like, what do you recommend patients do if they're experiencing maybe extended periods of diarrhea? Like, what do you suggest that patients do?
Okay. So we talked about the morning routines. I think that's helpful. I have people set up a little diary. I have some people take their iPhone, their smartphone, and set up a little reminder, hey, don't forget to take your medication. That's a good way to do it, or set their clock or their smartphone. If they have diarrhea for more than a few days, that doesn't resolve on its own. We may have them start skipping days, sometimes taking the medicine with food slows the absorption, and therefore diarrhea goes away with that. It's little simple tricks.
And what about the importance of communicating with your providers? Let's just talk about how important this is.
Wow, that is so silly to ignore that. Yes, please let us know. So one is hopefully we've had that discussion in advance so you're prepared if those side effects might occur. But certainly please let us know. And at least in this day with electronic methods of communication, many patients find it very easy to send a quick email in to their doctor or nurse practitioner, PA, and we can quickly get back to you and say, hey, don't worry, just go to every other day dosing or cut the dose in half or take with food and we'll take care of it.
And what advice along these lines, what advice do you have for your patients who feel frustrated when treatments take time? Like, what are some tips that you have for those patients?
Yeah, we all want magical solutions, don't we? We want to get better now. And I think, especially in this generation now, we're so used to immediate responses, right? Think about going to the internet. You get an immediate answer to your question. And think about all the access to technology where we get these immediate benefits. The problem is medicines don't work like that. And medicines take some time. So I think, again, it's that nice discussion about setting expectations about the time for response. And part of that then is to remind patients that we don't have 30 medications to treat IBS with constipation, right? For prescription medications, we really have 4 available medications right now. And so if you give up too early, you may have lost that opportunity to achieve benefits. So give it some time.
So what does the research show about how long it takes for IBS treatments to start working and how effective are they? And then to follow up with that, I know you like when I drill you with like questions in a row, but they all kind of go together. When is it time to ask your provider to try something else?
Let's think about that patient with IBS and constipation, and you put them on drug A, B, or C, and you have them check in at 4 weeks or 8 weeks, and they say, look, Dr. Lacy, constipation is better, bloating's better, but I'm still struggling with abdominal pain. What do I do? And this comes up an awful lot. And what I would say is, first of all, if somebody says the drug is not working, the first thing I always clarify is when you say it's not working, what do you mean it's not working? Does it mean it's not the constipation benefits or the bloating benefits? Oftentimes is the pain benefits. So what I might say then is, wow, we've had some success. You're just telling me constipation is better, bloating's better, but pain is not where you want to be. Then I might say, let's continue the medication, but let's think about other things we can do to treat your abdominal pain. And this comes back to the concept of augmentation therapy. And in this day and age, there are lots of ways where we can augment the gut directed medication with something else. So, do we think about behavioral therapy? Do we think about hypnotherapy? Do we add a low dose neuromodulator? Do we think about virtual reality? And the key point here is there are so many great options now where we can layer on to the medication directed at your gut that will provide benefits. So again, it kind of comes back to almost where we started. Don't give up too early, but also be educated, think about your symptoms, and try to explain to your healthcare provider what symptoms are not getting better so we can help.
Well, Dr. Lacy, as always, it's been such a pleasure, and I always learn so much from you, and I hope our listeners did as well today. We really want to thank you for sharing your expertise and helping us to better understand IBS-C treatment and the journey that's involved with it. Your insights really remind us that progress takes time, challenges are normal, and that communication with your healthcare provider is absolutely essential. If you're living with IBS-C, remember, you don't have to navigate this alone. Track your symptoms, share openly with your doctor, and keep exploring treatment options that fit your life. As always, you can find trusted resources. And as always, you can find trusted resources at gastrogirl.com and at the ACG at gi.org/patients.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.